So let's get back to the psychedelics, gentlemen. What different types of psychedelics are you interested in, especially, and why?
Dave.
Okay, so I'm more biased towards the natural ones, and I'm more biased towards ones that work primarily with DMT. So that would be DMT itself, ayahuasca, 5-MeO-DMT or Bufo, as well as psilocybin to an extent. Um, I'm also quite a big fan of cannabis when it's used properly and responsibly, and that was one that I have had a lot of use with in terms of furthering creating creative endeavors but also doing a lot of physical work with. Um, and I think cannabis is also something that people don't really think of as a psychedelic, but when you look at it, if you have to put it in a category, just like MDMA, it would be in the psychedelic category. The thing I like about DMT is that we have receptors for DMT in our own brains, and there's receptors for DMT in nature. I'm fascinated by ayahuasca because I think it's amazing that there are tribes all over the world who never got together and spoke to each other, found ways to blend two plants, one that contains DMT, which is not orally bioavailable, and the other one containing a monoamine oxidase inhibitor, which means that if you combine it, the DMT will become bioavailable, and then to drink that as a brew. I think that that's amazing that there were tribes all over the world who worked that out. And I think that it's a significant part of who we are and the experiences that we have. Um, so ayahuasca for me were very powerful experiences, but ayahuasca is also something which is like I don't know, it's like the trend of psychedelics, if I'm going to put an analogy for this channel on it. It's the strongest one. And it's something which is not for the faint of hearted, and it's also, I think, not for people who are not experienced. So one thing that I talk to my clients about, because medicinal cannabis is legal in Australia, so we can have this discussion, is around the intentional use of THC. And I think that this is something where, firstly, I prefer that the cannabis to be organic, because otherwise you're just inhaling and smoking a whole bunch of endocrine disrupting chemicals, which are Rudy's favorite. Um, and that's a horrible thing to combine with a psychedelic as well, if you think about that. So using an organic flower and using it for there's two things I like to use it for. One is for learning more about the body, so increasing mind muscle connection when doing things like mobility and yoga. If you've got tightness and you've got dysfunction and weak muscles, tight muscles, lower back pain, etc., you can learn a lot about your body with a yoga mat, a dimly lit room, some music, and a little bit of like organic sativa cannabis. I think that that's an amazing way that you can use a medicine to enhance your mind muscle connection to be able to get some therapy out of it. I also like to use it for creative endeavors, so for writing music, for brainstorming future ideas, these kind of things. But I'm always conscious to remind people that there are some studies which show that cannabis is not good for testosterone. What it does in particular is not very clear. Some of it's relating to the crude smoke itself. So I also think it's something that when you consider how the endocannabinoid system works, it's something that you don't want to use too frequently because you'll disrupt your own endocannabinoid production and become dependent. So I think using it less frequently is going to be beneficial for people. But yeah, those are my kind of key areas that I'm interested in.
Very good.
Yeah.
And for me, again, to stay within the U.S. jurisdiction, I only use ketamine with some of my patients. I've used ketamine. I've done a few sessions, and it's not a classic psychedelic. It's not like a DMT. It's an anesthetic agent that causes dissociation, but it induces neuroplasticity. So in the U.S., the only thing I work with is ketamine. I have a lot of interest on psilocybin and MDMA because the studies coming out of NYU, coming out of all the big universities are just amazing. There's this Netflix documentary, Fantastic Fungi. I don't know if it's on Netflix anymore, but it showed how they used, within studies, they used psilocybin with talk therapy on end-stage cancer patients and how they were able to overcome their fear of death and now be able to kind of live life despite facing death. That's a very powerful a tool. MDMA has really been studied for a lot of the veterans with complex PTSD and with talk therapy and MDMA, where they were able to reframe their traumatic experience. It's almost the observer. They were able to take a different view of their traumatic experience and reframe it and see it with love. At the end of the day, the Beatles were right. All we need is love. How do we get there? It's the big thing. So those three for me are the most important. I've always been very open about this. I went outside of the country and I used the DMT, I used Bufo, and it was completely life altering for me. Got me into a state, I was in a state of loss after I lost my brother by suicide. And that gave me a groundedness and a connection that I never thought I was ever going to be able to get there. So I have a lot of respect for this. But all of those, you need to have a lot of respect. Those are not party drugs. Those are things you do with respect, with the right set and setting, with the right environment, with the right therapist, if that's what's necessary. But they can be very, very powerful tools.
Yeah.
And I'll just tack on to that, and I think that if I look at all the experience that I had in countries where they were all legal at the time that I did them, of course, and when I've spoken to my clients about all the different experiences that they've had, the thing that I love about psychedelics is there's always these kind of universal themes and lessons or motifs that come up for people, which I think is fascinating. And one of the things that I think it does is, and this is what we were discussing before we went live, was that they often show you the work that you need to do. There was something that I was once told, which is that psychedelics will reveal whatever's in the way of your heart. I think that's another nice way of saying it, in terms of being like, it'll allow you to see yourself as what Rudy said, the observer, so you can have a more of an honest judgment of yourself. And I think that can allow you to also give yourself credit where credit's due. I think sometimes it can make you proud of yourself, or it can make you go, hey man, you're doing well. Like, props to you for, getting through where you're at, and you should be proud of yourself. So you can give yourself that self-love and awareness, but you can also see, okay, I've got these issues that I'm trying to solve, and maybe they're these surface level things, and now I can see what's underneath that's causing the problem, and showing me the work that needs to be done. And I think that's the amazing thing about these teacher medicines or these psychedelics, is that we have these experiences that then show us what we need to do, or how we need to change, and what we need to do differently. And then we can go and do that homework, and that might take days, weeks, months, years. And then you come back for the next lesson, or when you're having the next issue, when you're blocked, and that way you can learn. And I think that it's a truly amazing thing for practitioners to be able to see the importance of the health of the vessel and the body. So everything around the hormones, the nutrition, the lifestyle, all these different things. And then also see, okay, well, now what do we need to do with the psyche to get that to be where you need to go? And it's why it's so important to view the human healing experience as a holistic thing, and not be myopic with just one aspect of this or one aspect of that.
Yeah.
And that's been really Western medicine way of looking at healing or medicine. It's just, let's look at the body, let's give medication without really taking care of the inner healer or anything else available. For me, my goal is to really try to combine those two modalities for true mind, body, and spirit. We have the right tools for spirit. We just have to open ourselves, do the research, understand the research, do it the right way. But until you can really help the spirit and the mind, the body will never get to where you want to. The combination works amazing.